Hello guys, greetings of the day. Earlier dentistry was limited to tooth removal, fillings and giving artificial teeth for replacement of missing teeth. But now the dentistry has evolved and like everything, the dentistry has become smart dentistry. Cosmetics and aesthetics has started gaining popularity and smile designing has become one of the most popularly practiced dental procedure. One of the procedure of smile designing is dental veneers and laminates. Guys, I am Dr. Gaurav Gupta from Chikitsa Dental and my today's video will be all about dental veneers. Veneers are ultra thin shells of ceramic, porcelain or composite resin material which are bonded over to the front of the tooth. This procedure requires little or no anesthesia and can be an ideal choice for improving the appearance of your front teeth. Veneers are placed to mask discoloration, to brighten your teeth and to improve your smile. Veneers are an excellent alternative to crowns in many situations. They provide a much more conservative approach to change the tooth color, size and shape. Veneers can mask undesirable defects such as teeth stained by tetracycline or damage due to some injury or as a result of root canal procedure. They are ideal for masking discolored filling in your front teeth. Patients with gap between their front teeth or teeth that are chipped off or worn may consider veneer as a choice of treatment. Generally, veneers will last for many years and the technique has shown remarkable longevity when properly performed by some experienced dental professional. What to expect from the veneers? For about a week or two, you will go through a period of adjustment as you get used to your new teeth that have changed in size and shape. Brush and floss your teeth daily as you used to do it earlier. After 1 or 2 weeks, your dentist will ask you to return for a follow-up visit and minor adjustment, if required, can be done in that setting. Veneers are reasonable face smiles of natural teeth, but they are not perfect replacement. It's not uncommon to see slight variation in colors of veneers upon very close inspection, as this occurs even in natural teeth. Nevertheless, the procedure can greatly enhance your smile and can heighten your self-esteem. Now I'll quickly go through the process of getting the veneers done. Patients may need 3 appointments for the entire procedure. The first one is for the diagnosis and treatment planning. The second for the preparation of the teeth on which the veneers have to be given. And third is bonding of the veneers over the tooth. It's critical that you take an active role in the smile design. Spend time in planning of your smile. Understand the corrective limitations of the procedure. If required, have more than one consultation with your dentist to feel comfortable that your dentist understands your objectives about smile designing, why you want to go for smile designing. To prepare the teeth for veneers, the teeth are lightly buffed to allow for small added thickness of the veneers. Usually about half a millimeter of the tooth is removed, which may sometimes require local anesthetic if the patient's teeth are very sensitive. Otherwise, it can be done without anesthesia. Composite resin veneers are generally done in one appointment. This is also called chair-side veneers. After the tooth is prepared, the dentist can carefully bond and sculpt the composite material onto your teeth. For ceramic veneers, an impression of your prepared teeth has to be taken, which is then sent to the laboratory for the fabrication of veneers. This may take few days. If the teeth are too unsightly, then a temporary veneers can be placed at that time for an additional cost. When your ceramic veneers are ready, the dentist places each veneer on the teeth to check for their fit and get sense of shade and color. While the veneers are resting on your teeth, view the results and pay particular attention to the color. At this point, the color of the veneers can be slightly adjusted with the shade of the cement that is used to fix the veneers. The color cannot be altered once the veneers are cemented and permanently fixed. To apply the veneer, The tooth is cleaned with the specific chemicals to achieve a bond. Once a special cement is sandwiched between the veneers and the tooth, a beam of light is passed through it and the cement gets hardens and the veneers get permanently fixed over your teeth. So I think the procedure is not very difficult or cumbersome. A skilled dental professional can easily change your entire smile in just few sittings. You just have to know and evaluate your needs and discuss these needs with your dentist. Goodbye guys. Eat healthy, stay healthy and take good care of yourself. And once again, thanks a lot for listening to me.